Hello guys, welcome back to my YouTube channel. So first of all, I like to start this video by saying thank you to my two new subscribers, and thank you guys for subscribing to my channel. This helps me to get motivated to make such videos. So just after, I don't know, like after my long hours of duty today, I got time to make a video about this Plab 2 series. So today without wasting much of your time, today I'd like to start with the topic breaking bad news. So this is a very important topic in the Plab 2 situation, even in the real life situation, where you have to break news to the patient, which the patient might feel that it is that put them through a lot of stress. So just one point, like breaking bad news always doesn't mean that it's just about cancer. Okay, even the diabetes can be a breaking bad news scenario. It depends on how the patient reacts to the to the diagnosis that you give to him. Like even for like a simple I would not call it as a simple, but the episode of hypoglycemia, or the some if somebody has some intercerebral bleed, so that is obviously a breaking bad news station. But but for someone with just has a transient ischemic attack, and the person is a lorry driver by the occupation, or the bus driver, then it has some consequences for his employment or for his job. So that can be a that can be a case of breaking bad news to that person, to that patient. So yes, breaking bad news is not always about the cancer. Okay, so always make a habit of having that pause after giving the diagnosis, just to see the reaction of the patient, and you have to act accordingly. Okay, so about the breaking bad news, you just need to follow this format. It is called as spikes protocol, where S stands for setting the scene. So setting the scene means, like, whenever you know that it is a whenever you know the diagnosis and you think that, okay, so this is a breaking bad case scenario, so you have to set the setting, a private quiet place, okay, so that you can talk to the patient or the patient party. After that, you're just going to do your introduction part, the grips part, okay. The greeting, rapport building, introduction, right? So something like that. And if you're talking to the patient party, you have to check the relationship with the patient, just confirm that whom you are talking to. Okay, about the perception, so P is perception. This means that perception of the patient about his condition, or perception of the patient party about their patient condition. So you are just you just this perception means that what the patient knows about his or her condition, or what the patient party knows about his patient condition. Okay, so in this you can use such phrases like, could you tell me what you know about your husband or wife, if you're obviously talking to the patient party. So depending on what he says, you can say that, we did a CT scan, has anyone discussed the results with you, something like that. Okay, and could you tell me what has happened, is your husband managed for any medical condition, is he on any medication, something like that. Okay, so this is about the perception. Next, the invitation. So invitation is like you are inviting patient into the that zone where you are going to break the news. Okay, so you have to give various warning shots, and just, you can also call them as a buffer, like you have to warn them. It's just a warning shot. Okay, so you're not going to tell the news just directly, you have to do in layers by layers. So you can invite them, you are inviting them step by step to that point. Okay, so that can be very devastating for the patient or patient party to hear about cancer or something like that. So you can use these phrases like, buffer one, would you like to know about your husband condition, like just a warning kind of a thing. Okay, so do you want me to invite any family members to be with you, or I can call a nurse with you, just for the emotional support. Okay, are you ready for us to discuss the results? Just make sure that he's ready. And like, you can even say that, are you kind of a person that would like to know about his condition, about everything about his condition, something like that. Okay, and K stands for knowledge or narration. So this knowledge means now as being a doctor, you are providing knowledge to the patient or patient party. So actually what happened to the patient before telling the diagnosis, like what were the symptoms that he presented with, what was done in the hospital, and what the results, whatever the investigation done, like what was the conclusion of those investigations. So you have to provide knowledge to the patient. So symptoms they came in with, the investigations, the diagnosis. Okay, like you can say that you said your husband came in with some headache or something like that. After that we did a CT scan. CT scan is a special scan of the head, and upon seeing the scan we noticed that he has a condition what we call as subarachnoid hemorrhage. And pause. Okay, pause at this moment to see the patient reaction. So after that you can say, I'm so sorry about your husband is in a serious condition, something like that. Okay, so regarding this pause, I'm like to talk more. Okay, so just give me a few seconds where it is. Okay, so yes, always pause for a while to check the patient reaction. Okay, after informing the patient, and this implies to any scenario, not just the breaking bad news. Okay, so after informing the patient about the diagnosis, just pause for a few seconds. Okay, to allow the patient to react to the news you have just given to him. And this is called a chunk and check, like give the information and wait for the reaction, because you are going to act according to the patient reaction. So your next action depends on how the patient responds to the information. If the patient is very distressed by the news, then you have to show more empathy, like the verbal and non-verbal communications, the E protocol. Yeah, right. But if the patient is not shocked by the news, then you may as well take it slightly easier, but like you're still expected to show some empathy or the sympathy, but like but you can understand, right, whether this scenario goes into the breaking bad news kind of a scenario or a normal consultation will depend on the patient response. So yeah, this is a beautiful example I even told at the beginning. The suppose a patient who has just been told he has got diabetes mellitus might have such person might have a relative who is severely disabled from diabetes, and they might see themselves becoming disabled in a few years like their relatives. So this might trigger a more severe negative reaction to the news, while another patient who has never heard of diabetes might have almost no reaction to the news. So you have to take patient individually, like rather than taking the disease into like breaking bad news or non bad news kind of stations, which I told you, like it depends on how the patient reacts. Okay, so these are the thing about the pause, taking pause while after taking the diagnosis. Okay, so what about bad news. Okay, so after the knowledge part you come to the emotions. I've already discussed this in the previous videos. So E protocol. Okay, you have to explore the emotions, like I can see this is distressing for you, I can see this has come as unexpected. Okay, and after that you have to validate the emotions, the E protocol. I can see how difficult this is for you, I can't imagine how hard this must be for you, and and how have you been coping with all this. Like you can use these phrases. Okay, I also wanted to check, do you feel like you have support, something like that is validated, that you show some empathy. Okay, and in this kind of situation it is just better to avoid saying that I can understand what you are going through, because it will be a very hard situation for the patient. Like how can you imagine someone being diagnosed as a cancer? You can only imagine, it is the right word to say, but don't try to avoid to say that okay, I can understand, I know how it feels, like something like that. Okay, so it is better to avoid this sentence, I can understand. Don't say I can only imagine, I can see that it must be very hard for you. Use this sentence instead of I can understand. Okay, in this kind of situation. So I can only imagine what you are going through, avoid this I can understand. Okay, so empathy, I'm so sorry for what you are going through. I'm sorry for what has happened. You can use this kind of sentence. Okay, so about the strategy. So you've done everything, you came to the diagnosis, you handled the patient very nicely, with sensitively and empathetically. Now comes to the now what. So after this, how can you help as a doctor? So how are we going to help the patient? At this time you have to take, okay, so what is now the further management plan of the patient, what you are going to do about it. So this comes under the last part, the strategy, summary, and the support. Okay, moving forward, what we have planned, the investigation we are going to say. Okay, or any operation the the patient needs. If the patient has already reached to the stage that he cannot be treated or cured, then what is the palliative therapy that can be given to the patient? You have to explain those things to the patient, or even arranging a follow-up, something like that. Okay, so if you have a time, then summarize. But like during my exam, in the Plab exam, like I never used to summarize the consultation because I hardly had any time to finish the station. So obviously, if you have time or if you can manage it very efficiently, then of course summarizing would always be a best thing to do. But if not, then I cleared my 14 out of like 15, I don't know how much, 14 station. I think I cleared the 14 station out of 16, something like that. But like, so it doesn't matter whether you summarize or not. But just to be like, if you get time, obviously summarize. I never used to do it. Just my personal take on it. Okay, so is there anything else that you can help you with? So ask always this question, okay? Because most of the time when I was like mock simulator, like we already have the script, and we are supposed to ask some questions. Like there are multiple 4 or 5 questions that I need to ask as a simulator, as a patient, as an actor to the doctor. So obviously, if the questions has not been discussed by the doctor during my consultation, I'm going to ask about these questions. And if you do not ask this question, then if you conclude your stations without asking this question, then my questions will obviously be remained, right? Like it is not completed, so you might lose some marks. So always ask, is there anything else that you need me to help you with? Is there anything else I can do for you today? Something like that. So after that, he may ask like few questions. Even if she says no, I'm fine, then you can say this. Okay, this is a very beautiful sentence. Like, if you do have any questions or if there is anything you need, you can find me or any of the doctors here. We are always here to support you in any way we can. You can use this sentence. Okay, so breaking bad news has to follow a certain pattern. You need to break the news in layers, which I already told you, which means like you need to give warning shots. You remember the invitation part, right? Warning shots. Are you ready for something like that? Okay, so do you want to know, are you kind of the person who likes to know everything about his condition, something like that? Okay, the warning shot should be at least 4 or 5 phrases. You can just tell, okay, are you ready for this, or something like that. You have to just like use buffer before breaking the news. Breaking bad news also requires a doctor to show empathy. Obviously, protocol, okay, both verbal and non-verbal. This is, I'm not going to talk about this. So okay, so just to summarize the main points. Number 1, break the news in layers. Warning shots, remember, okay, just layer by layer. Do not directly jump to the diagnosis. When the news is broken, allow the patient to digest the news. Pause, okay, you remember the pause, right, after diagnosis, few seconds. Let them take as much time as they want. Okay, I just need to tell something about this as much time as they want. Okay, so I'm also like, I also read, I also went through the notes, and we were taught even in this institute that you should let the patient take as much time as they need after you break the bad news to them. Okay, so what happened to me in one of my mock exam is that I told the patient about the diagnosis. It was, I think it was lung cancer or something like that. And the simulator, the actor, what he did was this: just grab his head and like just look down, and he didn't say anything, no any expression. He didn't even cry. I was trying to offer the tissue to him, but like he didn't cry. I don't know what to do, and he didn't even speak anything. Like he just looked down and he was just scratching his head. So I don't know what to do. I just waited a minute, nothing. 2 minute, nothing. 3 minute, nothing. The bell ring, the 2 minute bell ring. Okay, so only 2 minutes remaining. I completely got hopeless during that time, and I messed up that station, and even I failed the station during my mock. So I didn't know what to do. So this is a very rare situation in the exam, but what I feel is that you have to always be prepared for the worst situation. So what if in the GMC the actor does the same thing? He doesn't show any emotion after he or she hears the news, and he just looks down. So you can do at that time is be clever and play that into your like weapon, change that, turn the cards around. Okay, so what you can do is that even after, just wait for 1 minute, you have to wait at least 1 minute. Okay, like give them time. So even after that, if they don't speak, then you can say, okay, I can see that this has come as a shock to you. Please take as much time as you need. I'm here to help you. If you feel like talking, then please tell me whenever you are ready. I'll be here throughout the consultation. okay? You have to just say these things, okay? Just make them comfortable, make them feel like, feel that you are there for them. By saying these things, you are at least initiating something, okay? Please take as much time as you need. I know that I can imagine that this can be a very hard situation for you. Please take your time. If you feel like if you feel like talking again, then please let me know. I'll be here, okay? Like, do you want me to call someone for you? Are you Don't say are you okay, like obviously you won't be okay. So you can just say that, okay, I can see that, yeah, this is very hard for you. Do you want me to call anyone to be here with you? Something like that. Just initiate something, okay? After, if he has not spoken for 1 minute, more than 1 minute, then you have to initiate something. By saying this, you'll at least the patient will respond to that. You will not just say stay dead silent, okay? And this is a like very worst situation. It not happen most of the time, okay? But the patient, generally in the exam, like the patient won't take much of your time, because they know that you have only a few minutes to complete the station. So don't try to rush them. Just be patient, maintain that tone, that composure, okay? So yes, these things you can do. And you have to show empathy, okay? Whatever they response, like you have to, after that you can, after showing the empathy based on their response, you can offer a glass of water or tissue only to the crying patient. If the patient is not crying, do not try to offer tissue, okay? Glass of water would be best for crying as well as non-crying patient. So yeah. And number 5 point would be speak at a pace or a rate and level of the detail which the patient can follow, not too fast, not too slow. This is a very sensitive station, so you have to maintain that tone, maintain that flow of your consultation. So not too fast, not too slow, not too happy, not too sad, okay? Just the medium. Keep the eye contact is for every station, okay? If you notice that the patient needs a break, you need to stop and ask them if they are okay. Okay, so if you are giving the information and patient suddenly starts crying, then don't just go and keep feeding the lot of information to the patient. Just just respond to their emotion, okay? If they are crying even after the diagnosis and everything, they might like get flashback and they might cry in middle of the situation. So just pause, okay? I can see has been very distressing for you. Please take your time. Just say these things and you just stop, okay, for a while. And the patient will obviously say, no doctor, it's okay, I'm fine, please continue, and you will get marks for these kind of things. So these are the things that I keep on telling these things in my videos, that look, everyone who is giving the exam are very fine doctors. They know the clinical management part. Everyone will do the same thing. So what differentiate you from them? These are the small things that differentiate you from others. How you respond to the patient, what is your interpersonal skills. These are the things they are going to check in the GMC exam. They will hardly fail you because you are not making the diagnosis, because it is very minute chance that you won't make the diagnosis. After practicing so much, so many cases, believe me, like when you go to the exam, when you just before going to the exam, like you'll be so much practiced and so much efficient that just by looking outside the cubicle about the scenario, you'll know what the diagnosis is inside the cubicle. So obviously everyone will make the diagnosis. So just be careful, okay? So it's not about the diagnosis and management, it's about how you conduct this station, conduct the scenario, okay? Yeah, so these are the things about the Breaking Bad news. So I don't think that there's much more thing to explain in this news. You have to just follow the spike protocol and just practice the questions from the whichever notes you are preparing, and this will be easy for you guys, okay? But these are just the main tips and tricks that I have to say to you. And obviously, as I told you, that always ask questions. Do you have anything else to discuss today from what you have discussed today? You or she must obviously will have some questions, and if they have, then they will ask these challenging questions in such kind of like scenario. Okay, so these questions are like, patient, so how long does he have to leave doctor? So it is a very difficult thing to answer as being a junior doctor, right? So you can say, if you know, like sometimes in the cubicle it is known that, okay, patient has 6 months remaining. So if that information is provided to you, then you can say people with this condition at this stage of the disease usually live about 6 months, but sometimes it could be a little bit longer, or it can be a little bit shorter, okay? Remember, whenever patient asks such kind of vague questions, your answer should not be yes, or it's or no, it should be in middle, right? So by saying this, you are not saying it's 6 months, it can be more like 7 months, 8 months, or a year, or it can even be a less like 5 months, 3 months. So just be in safer side, okay? In this case, it is appropriate to give this response because you know it's 6 months by given outside the cubicle, or you are familiar with the case, okay? But if the scenario does not specify how many more months the patient has to live, so do not make up things for yourself, okay? You can say like this, you can respond to such question by saying this: it is a difficult question to answer at the moment, but I will consult with my seniors to find out, and I will surely get back to you with an answer. Is that okay? So yeah, like you can say these things, okay? Another question: doctor, I am no longer able to walk, so how will I cope financially? I was the sole owner in my family member, so we'll own now. Okay, then you can say like validate the emotions, okay? So do not worry, Mrs. Jones will obviously refer you to social services for financial help. Will that be okay with you? Yes. So yeah, I can say that. And this is a very, I think this one in one of my mock I got this question, like patient said, okay, why doctor, why me? Like I'm always do my things very very nicely, and I'm a very good person, so why this has happened to me? And I don't know like what to say at that moment. I'd said something random things. I don't know what I don't even remember what I said. But you know, the correct way to answer this kind of thing is that you have to say that it is a difficult question to answer. The cause of this condition is unknown. There can be a various cause, but it can also be some idiopathic or unknown cause. But there are some people who are at risk of developing cancer, like for instance those who have a family member who had cancer, or if he has been smoking for a long period of time. So these are the risk factors, okay? So sorry to ask you this at the moment, but is there anyone in your family who has ever been diagnosed with any type of cancer, or has he ever smoked, okay, smoked like cigarettes or something like that? You can say this. So and also with if the patient has some positive history, yes, his father had cancer, or yes, he used to smoke, then you know this is a very sensitive station. So do not say, okay, so you see that was the cause for this cancer. You can't say like this, okay? It will be very unrealistic and unsympathetic kind of a thing to say, okay? So okay, so see, I found the cause, that was the cause. You have to be very sensitive in this kind of thing. Even if they say yes, they, even if you find their family members had cancer, or he or she has been smoking, you cannot say these things, so that they might blame their family, or they might blame their habit, they may regret this, okay? So you have to be supportive in this kind of thing. So what you can say instead is that, okay, so I would like to emphasize that these things just put someone at risk of developing cancer, but they are not necessarily the cause. It could be the cause. I'm not saying that these are the things that led to the cancer of this patient, so they are to the blame for this cancer. No, this could be the cause, like, but you know, I think you guys understood. So you have to, you can say like this: I would like to emphasize that these things just put someone at risk of developing cancer, but they are not necessarily the cause, okay? And this is just a short note, like if the diagnosis is of mesothelioma, and the patient is exposed to asbestosis during their walk, then sorry then you can say that if he has been exposed to asbestosis during the if he has been exposed to asbestos during his work, then obviously you can help them. They will get compensation because of asbestosis association. So yeah, you can say that these things, okay? So this is all about the breaking bad news. I okay guys, so I think this will help you in one way or another, and I hope you like this my videos, and please do subscribe and give a like or comment if you feel that these are helpful, and please share among your friends, and I will see you next time with more interesting videos. Maybe next time I'll just do I don't know, let me see whatever I'll just put, but I'll put something useful, okay? So good luck guys with your preparation. See you next time. Thank you.